Today we'll be discussing neonatal nursing. Neonatal nursing is a specialty area of nursing that focuses on the care of newborn infants. Although you may find yourself working with healthy newborns, a neonatal nurse primarily works with infants in the Neonatal Intensive Care Unit, or NICU, who face a variety of problems such as prematurity, birth defects, infection, or other surgical issues. To become a neonatal nurse, you need to receive certification in neonatal resuscitation and neonatal intensive care. These certifications are available via internships at certain universities or can be obtained through on-the-job training programs provided by hospitals. Neonatal nurses need to have excellent time management, communication skills, and decision-making capabilities, as well as a sense of compassion and integrity for both the infant and their family. Like all nursing careers, the job growth for neonatal nurses is predicted to increase dramatically within the next 10 years. Neonatal nurses are needed in hospitals to provide quality and compassionate care for humanity's most fragile beings, as well as serve as an emotional support system for all parents whose child is in the NICU, rather than at home with the rest of the family.
As a further precaution, we ask all visitors and staff to gel in and out each time you leave and return to the bedside. Alcohol gel is available at the baby's bedside for this use. Cover gowns are located at the door immediately after you enter the nursery. Neonatal units are full of equipment that you may have never seen before. Understanding the equipment and what it's there for can make you feel more comfortable. I'll show you some of the equipment you might come across in a neonatal unit. After being admitted to a neonatal care unit, that baby is likely placed in an incubator, which helps regulate the baby's temperature, something which premature babies particularly struggle to do on its own. Various monitors are used to keep track of the baby's condition minute by minute. A cardiorespiratory monitor keeps track of the baby's heartbeat and breathing. Babies can have a number of tubes attached to them to give them fluid, nutrition, and medicine.
Neonatal nurses have both technical duties and emotional responsibilities for both the medical team and the patients. NICU nurses tend to the baby's needs from the time they are delivered to the time they leave the hospital. According to the College Foundation of North Carolina, neonatal nurses attend deliveries, weigh and measure infants, bathe them, and monitor their health. The foundation also states that it is the nurse's duty to operate ventilators, IVs, and other medical equipment. A NICU nurse will chart all details and information that pertain to the infant so that everyone involved in the medical staff will have accurate and up-to-date information. This ensures quality care for the neonate. In the first stages of life, neonate babies are tiny, delicate, and must be provided with special care. One of the most important tasks of a neonatal nurse is to communicate with and educate parents on day-to-day operations as well as home care procedures. Another important task is to provide emotional support. Neonatal nurses are often the unsung heroes to families and are able to give the earliest of lives a fighting chance. Their daily duties add up to countless miracles and a rewarding career at the same time.
All types of nursing can be stressful at times, and NICU nursing is no different. You are not only dealing with the patient, but the parents as well. It can be heartbreaking to see what families go through when babies do not survive. The long hours and stress can be physically and emotionally draining. For example, a baby you once thought was stable could collapse into a coma and die without any warning. Rushing a struggling newborn from the labor room to the neonatal intensive care unit and then providing intensive care is an extremely stressful situation that can occur several times during a nurse's shift. Parents of critically ill infants are often demanding and desperate. Neonatal nurses must learn to handle difficult situations. Burnout is also a factor. It is a response to a workplace stress that results in emotional and mental exhaustion, depersonalization, and decreased sense of personal accomplishment. The neonatal department is made up of two units, the unit that cares for healthy newborns and the unit that cares for premature and sick newborns. In the neonatal intensive care unit, nurses closely monitor infants who have been born prematurely or are suffering from any number of neonatal complications, including but not limited to birth trauma, birth defects, and oxygen deprivation. Parents are an important aspect of the care delivered by NICU nurses, and thus clear and concise communication with parents and loved ones is paramount. Fear and anxiety about the condition of a neonate is common, and the nurse must address the parent's understandable knowledge deficit on a daily basis. The stress level doubles in a hospital since the atmosphere is unfamiliar to the parents, especially in NICU, where the environment is enclosed.
Even with all the responsibilities and stress, neonatal nursing is a rewarding career as you help care for and nourish an infant back to health.